Hello there, and welcome to Chita Diaries. For the people who are new, for my oldies, welcome back. So, we are in October, and it is Breast Cancer Awareness Month. I had hoped to do a whole month of women's health chats, but unfortunately, due to other circumstances, I am only able to do two videos. So today's video, as you can see from the title, will be focused on breast cancer awareness as well as cervical cancer awareness. I managed to get an expert. Huge shout out to VANELLE Musonda, who I managed to record an interview with via an online meeting. So I'll be playing that clip shortly. But honestly, truly, I hope that you find the clip that I'm about to play very very useful and informative. I should have posted these videos earlier in the month, but yeah, now or today is the only time we've been able to record this. So I hope to post this either by the 25th or the 26th of October. So you still have like a good 4 days to go and get yourself screened, which is my hope, like honestly, truly, and the purpose of me doing this video. So yes, thank you so very much for having tuned in. And now I will just proceed and show you the clip of the interview that I did with my guest speaker. Okay. So, hello, Janelle, and welcome to my channel. I'm Chita. I go by Chita Diaries on YouTube, as I had mentioned, and to my viewers who are watching, welcome to this video as well. So, I have a very special guest today. I have Janelle Musonda. You may kindly just introduce yourself as well to the viewers who will be watching and just tell us a little bit about who you are and your profession and the like.
Okay, thank you so much. Hello, everyone, and thanks for joining in. So my name is VANELLE Musonda. I'm a nurse. I'm a specialized nurse. I'm an oncology nurse, which means I'm specialized in cancers, and I work at the cancer hospital since 2013. So this is actually my 10th year of working at the cancer hospital, and I'm very privileged with this channel. Thank you so much.
Thank you. Thank you. So, as I had mentioned briefly in my intro, today's video is about breast cancer awareness as well as cervical cancer awareness. So we're in the month of October, and I thought it would be really, really beneficial and important, to just have a chat, and of course with a professional who is here with us today. And I truly hope that you find this video useful. So to begin with, I think we can just start with breast cancer in particular. And if you're able to, maybe you could just kindly share some current statistics of, the cases that we have in Zambia.
Okay, thank you so much. The current statistics, I think I'll start with, because as we talk about Breast Cancer Month, in Zambia, as we look at the statistics or the Breast Cancer Awareness Month, we try to also incorporate other cancers. And then looking at the fact that we're looking at Breast Cancer Month, we try to incorporate other cancers that affect women. And so one of the cancers that affect women, the most cancer that we are seeing, which is really a sad sight, is cervical cancer. So if we look at the statistics of cervical cancer, we have statistics that are showing to say Zambia is currently number 3 globally. So which is a sad sight, considering that the health and nurses have tried to put in so much in trying to screen for this preventable cancer, because cervical cancer is preventable, unlike when we talk about breast cancer. So being number 3 globally is something very alarming, considering that Zambia has been screening for the past, I think, since 2006, when we started the screen and treat. So with cervical cancer, you can screen and treat the client there and then, and it will prevent the woman from going to the cancer hospital. But when we talk about statistics of breast cancer, I like to refer to what is known as global can. So GlobalCan is a website where statistics will be thrown there, global cancer, so to say. So when you pitch in global cancer and specify Zambia, it will show you statistics of different cancers in a particular year. So because of COVID, the site hasn't really been updating on a regular basis, the statistics. And so the current statistics that are there will currently show that 7% of the cancers that are being seen at the cancer hospital are attached to breast cancer. But then that 7% doesn't mean that it's a small number. We categorize it to be one of the 5 cancers that we are seeing. 5 by it being cervical cancer being number 1. We have Kaposi sarcoma, which is also related to HIV-related cases, being at number 2. Then we have prostate cancer in the men. Then breast cancer comes in, and then we have the children cancers like nephroblastomas. And so these are alarming numbers, but then if women screen earlier, they would be treated easily. Yeah.
Okay. Thank you for that insight. It is very sad to hear, just how serious the number of cases we have here, especially for cervical cancer. So my next question would be, what are the known causes for both breast cancer and cervical cancer? If you're able to just assist us with that type of information.
Okay, so I'll start with breast cancer. Okay. So with breast cancer, like let me say, in most cancers, they'll tell you to say the cause is idiopathic. By idiopathic, it means it's unknown, because genetic or mutations will take place. Things in the body just go wrong, and this tumor starts forming, the cells start growing. But then we have things that are definite, like genetics will play a role. And then we have modifiers, or maybe environmental modifiers, like we can call things that would predispose us, me and you, Chitalu, to these conditions, such as environmental factors. So the environment will play a role. Is the environment exposed to more radiation than the other places? So that is one of the environmental factors. Do I live in an area where I'm more exposed, the mining areas, for example, silicosis issues and all those, for example. And then the other thing would be diet, the kind of diet that we have nowadays. Living in urban areas, we think a good life is where I eat meat products, fatty food, and then we do not realize that we are actually predisposing ourselves to more of these conditions than the people that are living a basic life and eating more healthy food, like more greens. Then lack of exercise. I think we're slowly becoming a fat generation, if I can call it that.
Yes.
Being chubby is living a very good life. No, we are fat, we have gained weight and all that. Yeah, so lack of exercise also predisposes somebody to having breast cancer. When one lives a sedentary life, they gain weight. So weight gain, for example, obesity would be another risk factor. So in obesity, how obesity will predispose fat accumulation of so much fat tissue will enhance the production of estrogen. And estrogen will furthermore predispose this woman to having breast cancers. Then the other one will be maybe early onset of menarche, period starting. So you start your period early. So the longer you're exposed to hormonal exposure as a woman, and late onset of menopause also is another predisposing factor. So basically, the other thing is, I could just say, by nature of being a woman, you are more predisposed to having breast cancer than in men, because even men have breast cancer, but the percentage is lower. Yeah. So the other thing, I would like to make a very valid point here, Chitalu, on the issue when people say, please, men should suck the women's breast. You know, we have this preconception that by doing that, we prevent breast cancer. So the point here is by saying breastfeeding. So women, if we compare women that are breastfed before and how many times they've breastfed and how many years, the exposure is less on women that have had children earlier and have had actually breastfed their children for a longer period of time than women that have never had children before and have never breastfed. And that's the secret. So when a woman is breastfeeding, certain hormones are cut.
Okay.
So this woman says prolactin, and there's a cut in the estrogen, which will predispose more exposures or risks of having breast cancer. So those are not the list of the risk factors, but those are some of the risk factors that I can mention on breast cancer causes. And then I'll move now to cervical cancer.
Yes.
So on cervical cancer, I like to say if you were to compare the two, breast cancer and cervical cancer is one of those cancers that can be prevented, unlike breast cancer, because like we mentioned, breast cancer can be genetic. And so with cervical cancer, nowadays, not every one of them that we're seeing, but most of the cervical cancers, the most that we are seeing are more have to do so much with HIV positivity or negativity. Yeah, we have a number of them that are negative, but mostly we are seeing more to do with HIV exposure. So if we talk about the causes of cervical cancer, the cause is known in a sense that it is human papilloma virus related. Then on human papilloma virus, we've noted a whole lot of misconception that it is only passed from the men to the women. But then that is also another preconception that people need to actually really look at, because the HPV virus can also be passed from women to men. And so the issue of saying only an uncircumcised men will pass it, those are the misconception, because now it will be like, because you are dealing with a circumcised man, okay, let me be reckless, I may not get it, and you think only the uncircumcised man will pass it to you. But if we look at the risk factors of it, we talk about issues of women having multiple sexual partners. So the number of sexual partners that you have also puts you at risk from acquiring the HPV virus that may start eroding the cervix, which is the opening of a woman's womb. And then the other thing is having immunodeficiency diseases. When we talk about immunodeficiency diseases, we'll talk about maybe HIV, for example. Being HIV positive will predispose a woman to having cervical cancer more than the woman who's non-HIV positive. At the fact that the virus will take advantage of the lowered immunity and capitalize on that and start growing on the cervix, hence bringing about cervical cancer. And then the other cause or risk factor would be early onset of sexual activities. So you have this young girl that engages in sexual activities early, and this, I would like to encourage mothers that have children below the age of, let me say, from 9 to, is it 13, that are being given the vaccine. It is very important for mothers to be encouraged to give their children the vaccines, because it helps in preventing cervical cancers in the future, because they'll have the immunization that they need to prevent this virus from bringing about the disease. So we've spoken about the age and sexual exposure. The earlier a girl or a woman engages themselves in sex, they expose themselves more to this HPV virus, number of sexual partners, and immunodeficiency diseases. Yeah, so those could be some of the causes, but not only limited to these. Yeah.
Okay, thank you. So the point that I assumed you're going to make, I remember when we had our talk 3 years ago,
Yeah.
you brought up
Yeah.
the issue of women using their own methods, DIY issues, like inserting
Mhm.
stuff down there, and how even that could be a risk as well.
Exactly.
Yes. So
Yeah,
that's what I
and that's
hoped you
why
would touch on.
Yeah, and that's why I said they're not only limited to this. I'll tell you for a fact. I've been doing a number of cervical cancer screening in the community with different women from all sectors of life. By that, I mean with people in the office, to the basic woman who's selling tomatoes. And so you find that different women have all these methods and these antiques that they've built up around themselves to try and please the men. And you find women inserting all sorts of things in the vagina. They will insert insungo, for example. And if you see in the insungo, you relate it to the easy nicotine issues in smoking cigarettes that will bring about breast cancer or predispose the woman to breast cancer and cervical cancer. So it still works in the same mannerism, because if they smoke the nsungo, there's that feeling of highness. And so meaning it has a component of maybe nicotine that makes them feel some sense of euphoria and all that. And so by them inserting it in their vagina, it will start changing the genetic makeup of the cervical um, lining, so to say, epithelial lining, and bring about all these conditions. So inserting of fingers when washing, I think one other method, one important point to mention is that women are not supposed to insert their fingers as they wash their private part. It is not necessary. I always like to give an example of the throat. When we have a flu, I don't think we insert fingers to try and bring out the sputum from the throat. The throat has its own way of cleaning itself. It's the same with the woman mechanism down in the reproductive system. Same when we have the period, we don't have to pull it out to say come out. It comes out on its own. So women just need to wash on the outside and not insert fingers. It's not necessary, but them inserting fingers, they just introduce um, infections and causes these predisposing factors. Yeah.
Okay, thank you for that. Yes. So
Yeah.
my next question, I think for both breast cancer and cervical cancer, is how does one get tested, and what tests do they ask for? Where do they, is it available in every clinic, every hospital? What type of specialists should they see for both in terms of testing?
Okay. Cervical cancer. I think as a country, we are very privileged. We, in other countries, I'll tell you, cervical cancer screening is quite expensive. But as a country, the ministry has done a very good job. Government, the Republic of Zambia has done a very good job. We are able to access the service for free. And one important part of the cervical cancer screening is the fact that it's a screen and test service that is being offered around the nation. I think there are over 300 sites that are offering cervical cancer screening. So most of the local clinics are able to offer that service.
Okay.
There are different clinics around. Lusaka, I would mention a few: Chilenje, Kabwata, UTH is able under AIDC, which is Adult Infectious Center. Then we have Charleston, different places around the nation. In every province has different screening sites. I'll mention currently I'm in Chinsali. We are here doing the Breast Cancer Awareness Month, where we've now incorporated other services that we are doing. And at the clinic where I am, they're doing cervical cancer. This is in Chinsali. So the government is offering VIA, which is a visual inspection with acetic acid for cervical cancer. It's a very simple test that women can tolerate. There are preconception about women, no, it's painful, no, it's uncomfortable. You are able to stand the uncomfortability for a short period of time, but know your status as a woman, which gives you the power to decide how you want to be in the next 3 years, because dependent on the test, you have 3 years to go for the next test. And then if you come to the facility when there are no signs, it's a very good opportunity for you to be treated. If it's found early, the cure rate is better than when you come when you have symptoms, not a backache, I'm bleeding after having sex with my partner, there's pain and all that. So a simple VIA will be done, which will be less than, I think, 20 minutes to the max.
Okay.
Or the other test that we can do is a HPV swab. So different sites are doing HPV swabs, of which if you want to do a self examination, a test kit can be done. All you need to do is you have a brush in the kit, there's a brush and there's a specimen bottle. So you swab on your own. The health provider would definitely explain how to do it, but you swab on your own and put the brush in the collection tube or bottle and you submit to the center where you're being attended to. The other type that they can do is a pap smear. A pap smear also will be done by a health provider where scrapings from the vagina will be collected and then read by a pathologist or somebody from the lab technician and be able to be interpreted. So those are some of the tests that can be done under the cervical cancer. But when we come to the breast cancer screening, mostly the simplest that a woman can do is a self-breast examination. I like to emphasize on a self-breast examination. By the way, Chitalu, you look good. I like the pink ribbon on your chest.
Yes.
Thank you
I was
so
trying
much
to
for.
be on theme, and yeah, for the purposes of awareness. Yes.
Yeah, so a self-breast examination is done by the woman herself. I like to emphasize on a point to say it takes me as a woman to know my normal breasts for me to be able to identify that there's a problem and seek medical attention. So as women, I'm encouraging every woman out there to take opportunity and learn their own breasts. Don't be shy to feel your own breast. Every month, if you're a woman who's still having a menses monthly, so take 7 days after your menstrual period, sit by a mirror, look at your breasts. Are they the same? Yeah, I know that the breast might be different, partially in size. One breast might be other, but by now we know to say, okay, yes, this is how I am. So that in case that there's a difference in the normal that you have, the abnormal that is there now becomes more abnormal, you'd be able to identify. So by sitting on the mirror, you look at, okay, this is my normal breast. Is there any changes? Are my nipples cracking? Is there any rash? Do they look swollen? Do they have like an orange peel type of appearance? By orange peel, you see the breast having some dimples on it, so to say.
Okay.
Are the nipples rich? Yeah, are they pulling in? Those are some of the signs that you look at. As you do a self-breast examination, you look out for those. Once you identify that, we're not saying that it is breast cancer, but those are some of the signs that will tell you to say, I need now to seek a medical personnel to look at them further. So that is under self-breast examination.
Okay.
So when you come now, lump is there in the breast? Is there a lump? Do you feel any lump? Is there any pain? It would tell you to say you need to see medical attention, seek medical attention. The other method of checking is by a woman doing a clinical breast examination. So by clinical breast examination, this is where now you engage a medical personnel to screen. It can be done either every after 6 months or every year, once a year, annually. So you seek medical attention depending with the age. For women above the age of 40, they can also do a mammogram. A mammogram is a simple X-ray type of breast scan that can be done. So mammograms can be done for women above 40, but for women that are below 40 years and they think, okay, I need further tests to be done on me, we can do a breast ultrasound. So those will help us determine. But the only definite test that somebody can do to really say, okay, this is a breast cancer is by one doing a biopsy. and it still applies to the cervical cancer. A biopsy is a definite confirmatory test that one can do to say this is a cancer and it is at this rate, or it's this type of a cancer. So the biopsy is a definite one. I hope I've answered the question.
Yes, thank you. You have. And I guess my final question will be,
Okay.
if someone goes through, they get tested, and they're diagnosed. I hope that's the right term. They're diagnosed with either breast
Yeah.
cancer or cervical cancer. What treatment do we have available in our country for both? And then I also believe there are different stages for each. Um,
Exactly.
yes. So what treatment do we have? And even just the chances. I know, like, okay, from media that I've consumed, you watch and someone will be told you've been given 2 years to live, etc., whatnot.
Yeah.
What treatment do we have here, and what are the statistics, or just the chances that people are given, to survive it?
Okay. Thank you. So I do not want to be quoted because I don't represent the government of Zambia by saying currently what treatment we are offering, but I'll mention the treatment modalities that we have.
Okay.
So treatment modalities would differ depending on the stage. So the most important thing about a cancer diagnosis is also knowing the stage. So if you know the stage, you're now going to know what is the intent or what is the goal of this treatment. I'm currently working under the palliative care unit at the cancer hospital. And so palliative will be incorporated from the time a diagnosis is made. You tell somebody, oh, VANELLE, you have cancer. By virtue of somebody being told you have cancer, they undergo certain psychological trauma because once a diagnosis of cancer is made, it is associated with death. And that's the preconception that we have as human personality. But cancer does not equate death per se, like it is put. What would determine the outcome is the stage at which the cancer has been found. You can be found with cancer today, but then it is in the early stage, say it is maybe in the first stage of its development. The outcome will be different with somebody who's in the fourth stage, which is the last stage. So staging, there's stage 1, stage 2, stage 3, and stage 4. Although in these stages 1 to 4, we have sub stages. For example, maybe it will be 2B, 3B, and issues like that, for example. And with that, the treatment will be different. Stage 4 mostly will be associated with palliative, meaning we are treating based on symptom management, maybe home-based care. Palliative, we're treating this cancer, but not really to cure. The goal is not curative. But in the early stage, say for example, stage 1, the goal will be different. It is in the early stage. We can easily do operation, remove the cancer, for example, breast cancer, we'll treat, give chemotherapy, shrink the tumor. Once the tumor has been shrunk a bit, with the chemotherapy, go do surgery, remove the tumor, come back, do surgery, radiation, sorry, do radiation with chemotherapy, moving concurrently.
Okay.
The outcome is very good like that. So meaning we have, based on the stage, we can either do surgery, chemotherapy, radiation. We can do all the 3 modalities. But other stages, maybe we can only give chemotherapy because the cancer is advanced and the only method we can treat is based on systemic management, because we know to say if we give radiation or chemotherapy, this cancer has spread. The only way we can treat the whole system is by giving chemotherapy because it will go in the whole system. In other cases, say for example, breast cancer that has gone to the spinal cord, and this woman has spinal cord compression, we'll say, okay, because the spinal cord compression affecting the lower limbs, this woman might become paralyzed or is unable to see properly. Let's give radiation palliatively. and we'll give radiation, then see other methods that we can use. So treatment also is based on individual beings, based on the receptors that we have and the type of cancer, breast cancer that we may have. One woman might receive a different treatment from the other, despite both of them having breast cancer. But basically, the methods that we are using in Zambia is in breast, we'll either do surgery, chemotherapy, which is given intravenously or oral. Then we'll also give radiation. There's also hormonal treatment based on the type of cancer we're treating. Some women will be given hormonal types to try and control the cancer growth. And yeah, I think that is what I can talk about the treatment method. Yeah.
So that was for both breast cancer and cervical, or just for breast?
So in cervical cancer, the only difference will be that we might not give hormones. There's no hormone relation in cervical cancer, but in breast cancer, we might treat with hormonal supplements. There are drugs that we give for now. I think now we are giving, is it 5 years? Depending with the type of receptors that are there. But in the cervical cancer, it's either we do surgery, give chemotherapy and radiation, but also there's what we call radiation will be in two forms. There's a external radiation where the woman will go for a certain number of fraction. By fraction, it means more of doses, like how many times they'll go for radiation exposure. Is it maybe 20 days? So we count them like in fractions because the days will be divided based on the total dose, and each day they will go receive a certain dose. Then maybe 3 times they will receive external, which is known as brachytherapy. So the other type of radiation is external beam radiation. Brachytherapy is more on the internal, that's when we're treating cervical cancer. So we insert the radiation direct on the affected cervix to treat the internally. Because the other one is like on the surface, yes, we've measured, we've made the plan to say this is the part where we'll be radiating. But with brachytherapy, we go through in the vagina and treat. That's under brachytherapy for cervical cancer. So with cervical cancer, it's basically chemotherapy, either surgery, you can do a total hysterectomy, or in mammo, a total hysterectomy in
Meaning,
cervical cancer.
so a hysterectomy means the removal of the uterus, just in case.
Yes.
Yes,
Yes.
someone doesn't know what that is. Yeah.
Thank you. Yeah.
Right.
So then in breast, like I mentioned, surgery will be a mastectomy where the breast is removed, but then it can either be a partial mastectomy or a radical mastectomy where everything is completely removed, including the lymph nodes, and yeah, basically that.
All right. No, thank you so much. I'm sad that we have to close off the video here because of time, but I truly appreciate you taking the time to just, be here with us and give us this valuable information. For my viewers, I truly hope you found this useful. And if you have any more questions, please leave them in the comments below. If you'd like a part 2 and a more detailed video, hopefully, at some point in the future, it could be in a couple of months' time, we could do an updated video, if that's okay with you, Janelle. I'm not sure.
Yes, definitely. Yeah, definitely.
All right. Yes. So thank you so very much. If you have any closing remarks, please you may kindly do so if you wish.
Okay, yeah, thank you so much for this opportunity, and I'm really very privileged. I think my closing remarks will be on the importance of screening. I think it's now high time that as Africans and women, we move away from the preconception of saying until I'm sick, that's when I'll go to the hospital. I think we need to make it a habit to screen even when I'm not sick. I don't need to feel the symptoms to get up and go to do a cervical cancer screening or a breast cancer screening. It should be part of us. And being in this day and age, I think we are now seeing the statistics, the numbers in cervical cancer, breast cancers, and just cancers in general, that are rising. Back then, we did not have the statistics, we didn't have the information, but we are privileged now. We are able to screen, we are able to prevent. So my closing remarks will be, as mothers, let's look out for kids. There are a lot of other cancers that can be prevented in kids. A simple, for example, retinoblastoma, a simple look in the child's eye would save a child's life from birth. As women, we have the power to hold a life in our hands. As women, we are the foundations of our homes, because when a woman stumbles, the house is shaken. And so let's take care of ourselves. Take advantage of these screening services that are being offered and get screened. Let's save lives by detecting these conditions early. Thank you so much.
Thank you so much. And my viewers who are watching as well, like I mentioned before, I truly hope you found this useful. And yes, I will see you in the next video. And hopefully for Janelle, we will have you here on the channel again in the future. Thank you so much once again, and we shall close up here. Bye.
Thank you. Bye-bye.